Right now, a single number on your blood pressure monitor could be the deciding factor between living your life as normal or facing a life-altering emergency within minutes. My name is Dr. Robert, and 2 decades of medical practice have taught me something that stays with me every day. Most people don't suffer devastating health crises because they were negligent. They suffer because nobody ever equipped them with the right knowledge at the right time. If you're looking at a reading of 180/100 on your monitor right now, put everything else aside. That figure isn't simply a bit high, it's your body screaming that your arterial walls are being pushed beyond what they can safely handle. In clinical settings, we refer to this pressure range as the zone of imminent danger. The consequences can unfold shockingly fast. Uncontrolled pressure at this level can tear open a blood vessel inside your brain, triggering a stroke that might confine you to a wheelchair or permanently strip away your cognitive function. What makes it truly terrifying is the absence of any build-up. There's no dramatic warning, no escalating pain to alert you. This condition earns the name silent killer for good reason. Now here's something that physicians rarely get the chance to tell patients before it's too late. The actions most people instinctively take in this moment are exactly the wrong ones. Thinking about stretching out in bed until it passes? Planning to grab your keys and race to the hospital? Both of those responses can make things significantly worse by driving your pressure even higher and accelerating the very crisis you're trying to escape. What actually works is a structured 5-minute physiological protocol, something you can carry out right where you're sitting, in your own home, without any equipment. It works with your body's own mechanisms to bring the situation under control before permanent damage occurs. Put aside everything you assumed you knew, because the following steps could genuinely be what stands between a frightening moment and an irreversible one. Step 1. The vascular safety position. The moment you feel lightheaded, notice your vision going blurry, or experience a pounding sensation at the base of your skull, every instinct in your body will push you toward bed. Rest, lie down, close your eyes, it feels like the logical response. But acting on that instinct right now could be one of the most dangerous decisions you make. Here's the physiological reality. When your blood pressure is already critically elevated and you lie down completely flat, you remove the one natural force that was helping contain the situation, gravity. In an upright position, gravity works to keep a significant portion of your blood pooled in your lower body. The moment you go horizontal, that mechanism disappears, and blood surges freely toward your brain, spiking intracranial pressure at exactly the moment your vessels can least afford it. A useful way to picture it, imagine a pressurized hose. Stand it vertically and the water has to fight gravity to rise. Lay it flat and the water blasts through with nothing to slow it down. Lying down during a hypertensive crisis is the equivalent of laying that hose flat. It removes every natural barrier between the pressure and your brain. The correct response is to immediately move into what's known medically as the Fowler position, or semi-seated position. Sit yourself down in any chair or sofa that has a proper backrest. Keep your torso between 45 and 90 degrees, upright or slightly leaned back, but never horizontal. Palm both feet flat on the floor and resist the urge to cross your legs. This positioning allows your leg veins to act as a blood reservoir, holding volume in the lower body through gravity and naturally easing the load on your brain and heart. If possible, support your head so your neck isn't straining, since muscular tension in the neck can compress blood vessels and make the headache worse. Notice how emergency medical teams always transport cardiac and respiratory patients in a partially upright position. That's not for comfort, it's a deliberate clinical choice rooted in exactly this principle. Elevating the torso reduces how much blood returns to the heart with each cycle, lightening its workload and creating a modest but meaningful drop in systolic pressure through physics alone. Those few extra millimeters of mercury can matter enormously when a blood vessel is already at its limit. Settle into this position, stay still, and let your body's own gravitational mechanics begin working in your favor while we address the next threat. Step 2. Nitric oxide breathing to deactivate adrenaline. With your posture corrected, the next enemy to tackle is one that's quietly making everything worse, the panic response. The moment your eyes land on a number like 180, your brain treats it as a threat and launches a full stress response. Your breathing becomes fast, shallow, and shifts to your mouth without you even noticing. This is deeply counterproductive. Rapid, shallow mouth breathing strips carbon dioxide from your blood faster than your body can regulate it. The resulting chemical imbalance causes your blood vessels to tighten further. On top of that, the stress signals being sent through your nervous system trigger a flood of adrenaline and cortisol, both of which stiffen arterial walls and push the heart to work harder. Each element amplifies the others, and your pressure climbs higher still. Breaking this cycle is not optional, it's urgent. Your nose holds the solution. The sinuses lining your nasal passages continuously produce nitric oxide, a compound that naturally causes blood vessels to widen and relax. When you breathe through your mouth, you bypass this entirely. Nasal breathing carries that nitric oxide directly into your lungs and from there into your bloodstream, where it begins dilating your arteries almost immediately. The technique to use here is called 4-7-8 breathing. Seal your lips and place your tongue lightly against the roof of your mouth just behind your upper front teeth. Draw a slow, full breath in through your nose over 4 seconds, letting your belly expand rather than your chest. Hold that breath for 7 seconds, allowing complete gas exchange to occur. Then release the breath through your mouth over 8 full seconds, as slowly and steadily as if you were softly blowing out a flame. That long, controlled exhale is what does the real work. It directly stimulates the vagus nerve, your nervous system's built-in deceleration mechanism, prompting your heart rate to drop and your arterial walls to soften. Your body transitions from high alert mode into a calmer, more regulated state. Work through this cycle a minimum of 4 times. You are not simply relaxing, you are chemically and neurologically intervening in your own blood pressure. Step 3. Thermal diversion with a warm foot bath. While you maintain your position and continue breathing, it's time to bring in a third tool, one that works directly on your circulatory system using nothing more than hot water and basic physics. Picture your circulation as a busy road network where all the traffic is backed up in the center of the city, your heart and brain. The goal isn't to remove vehicles from the road, it's to open up new routes on the outskirts so the congestion at the center can ease naturally. Heat does exactly that. When warmth is applied to your feet and lower legs, the dense network of capillaries and veins in that region responds by dilating. They expand, creating greater capacity. Blood, which consistently seeks the easiest available route, begins gravitating downward toward these newly opened, lower resistance pathways. Volume shifts away from the overloaded central areas, your brain and heart, and redistributes toward your feet. Internal pressure in the critical zones decreases as a result. To apply this, find a basin, bucket, or sink within easy reach without needing to move excessively. Fill it with genuinely hot water, target between 40 and 45 degrees Celsius, warm enough to feel intense on the skin but not hot enough to cause a burn. Submerge both feet. If someone is present and willing to help, warm cloths placed on your hands will extend the vasodilatory effect further. Within 5 to 10 minutes, many people experience a noticeable reduction in the pressure and throbbing at the back of the head, along with a clearing of the mental heaviness that often accompanies very high blood pressure. That relief is physiologically real, it reflects a genuine redistribution of blood volume away from the brain. One important precaution: if you have diabetes or any condition that reduces sensation in your feet, you may not feel water that is too hot. Ask someone else to test the temperature using their elbow, the same approach used when bathing infants, or use a thermometer to verify it before immersing your feet. A burn would compound rather than help your situation. Keep your feet submerged for 10 to 15 minutes. Add more warm water if it cools. Maintain your breathing throughout. Step 4. The hidden bridge massage, cervical release. At this stage you're positioned correctly, breathing well, and drawing blood toward your feet. The next obstacle to address is one that most people never think about: the neck. Stress and alarm cause involuntary muscular contraction throughout the body, and the neck bears a disproportionate share of this tension. The sternocleidomastoid and trapezius muscles, the large, prominent structures running along either side and across the back of the neck, seize up and harden under psychological stress. The problem is what runs through this region: the carotid arteries carrying oxygenated blood up into the brain, and the jugular veins responsible for draining used blood back downward. When the surrounding muscles are rigid, they physically compress both sets of vessels. Blood continues arriving under pressure but has increasing difficulty draining away. The result is a pressure buildup inside the skull, worsening the headache, increasing vascular strain, and elevating the risk of rupture. The solution is to manually release this compression through a specific, gentle acupressure technique. One critical warning before you begin: never apply firm pressure to the front of your neck, in the area where you can feel your heartbeat. The baroreceptors located there are highly sensitive, and aggressive stimulation can provoke fainting or, more seriously, could dislodge arterial plaque. Instead, work along the side of the neck using what's called the downward gliding stroke. Begin by placing your index and middle fingers in the soft hollow just behind your earlobe, at the point where your jaw meets your skull. From there, draw your fingers in a smooth and hurried line straight downward along the side of your neck until you reach the collarbone. The direction is always downward. You're encouraging venous drainage, not pushing blood upward. The pressure should be gentle. Think of it as a light, reassuring touch rather than a deep massage. Your aim is to stimulate the skin and the underlying connective tissue, prompting a relaxation signal to travel through to the vagus nerve. Complete 10 strokes on the right side, then 10 on the left. As neck tension releases, the jugular veins regain their normal capacity, and blood that had been accumulating in the skull begins draining more freely. Patients frequently report that their ears feel less pressured and their vision sharpens noticeably after just a minute of this technique, direct evidence of falling intracranial pressure. You've now combined 4 distinct physiological mechanisms: gravitational management through posture, neurochemical regulation through breathing, vascular redistribution through heat, and mechanical decompression through massage. Your body is being given every available tool to correct itself. Step 5. What you must never eat or drink: the invisible danger. Everything you've done so far is working in concert to help your body pull back from a dangerous threshold. Don't let a moment of poor judgment undo it. While your pressure stabilizes or while you wait for medical help, what you choose to consume, or avoid consuming, matters enormously. 3 categories of things that people commonly reach for during a health scare can actively worsen a hypertensive crisis. Stimulants, particularly caffeine. Severe high blood pressure frequently causes mental fog or drowsiness as oxygen delivery to the brain is compromised. The natural impulse is to reach for coffee or tea to sharpen your thinking. Resist it completely. Caffeine is among the most accessible and potent vasoconstrictors available, meaning it shrinks blood vessels. You've just invested significant effort expanding them. A single cup of coffee can reverse that progress, driving your pressure back upward. Avoid all caffeinated drinks, including energy drinks and cola. Sugary or salty foods. The dizziness that accompanies a hypertensive crisis is sometimes mistaken for low blood sugar, prompting people to eat something sweet or salty. Both are harmful right now. A sugar spike triggers an insulin surge that promotes inflammation throughout the vascular system. Salt, meanwhile, causes the body to retain fluid, expanding blood volume in your veins and directly raising pressure. In a critical window like this, even modest amounts of sodium are counterproductive. Keep your stomach empty. Aspirin. This is the most consequential point in this entire protocol. There is a deeply ingrained assumption, reinforced by years of public health messaging, that a suspected cardiac event should be met with an aspirin. That guidance is valid in the context of a heart attack, where a clot is blocking an artery. In a hypertensive crisis, however, it can be catastrophic. The distinction hinges on stroke type. An ischemic stroke, caused by arterial blockage, is the scenario where aspirin has a role. A hemorrhagic stroke, caused by an artery rupturing under excessive pressure, is the opposite scenario entirely. With blood pressure at 180/100, the probability of hemorrhagic stroke is elevated. If bleeding inside the brain has already begun and you take aspirin, you are chemically preventing the clotting process that would otherwise contain and seal that bleed. A small, survivable bleed can be transformed into a catastrophic, irreversible hemorrhage. Without imaging, it is impossible to know which type of stroke is occurring or threatening. Taking aspirin under these circumstances without medical guidance is not a precaution, it's a gamble with devastating potential consequences. Do not take it. The one thing you can and should consume is plain water at room temperature. Drink it gradually, in small sips, to support kidney function and maintain healthy blood viscosity. Drinking quickly or in large quantities risks nausea, and the physical exertion of vomiting generates a sharp spike in intracranial pressure, the opposite of what you need. To bring it all together, sit upright to let gravity protect your brain. Breathe through your nose using the 4-7-8 pattern to deactivate your stress response. Soak your feet in warm water to redirect blood away from the danger zones. Gently massage the sides of your neck downward to release vascular compression. And keep your body free of caffeine, excess sugar, salt, and unsupervised aspirin. A reading of 180 is alarming, but you are no longer standing in front of it without options. You now understand the physiology behind what's happening and have a concrete, step-by-step response to deploy immediately. Your body is built to recover. It simply needs the conditions to do so. Take a slow, deliberate breath. The capacity to protect yourself is already within you. I'm Dr. Robert. 20 years of practicing medicine have led me to one enduring conviction: knowing the right thing to do, and doing it at the right moment, can be the entire difference between walking away and not walking away at all. Act quickly. Stay calm. Stay alive.